Chronic pain is a really important area of study because it significantly impacts people's lives. It really affects everything that people do. It's considered a chronic disease now from the World Health Organization, and it's a major public health issue in Canada and worldwide. It's estimated about 8 million Canadians currently live with chronic pain.
Chronic pain is really pain that lasts for longer than 3 months. The pain might be on again and off again for 3 months, or unfortunately it might be consistent over 3 months. Unfortunately, with chronic pain, our goal is rarely to have it go away completely, and for a large number of people, that type of thing can't be found.
So when people have chronic pains, it typically requires an interdisciplinary approach, thinking about the physical aspects, the psychological, the social, and the environmental aspects that all contribute to one's experiences of chronic pain. And one person can't address all of that.
Having the perspective of someone who's able to diagnose it, having the perspective of a scientist who's doing research on this, having the perspective of a pharmacist who's looking at medications, PT, OT, all of those things have been shown to help people manage their chronic pain. A lot of what I do in my job is actually reassess and stop medications that don't work. The medications we have for pain right now don't work for a lot of people, and in fact have a lot of side effects that can affect function. Pain research is important because 1 in 5 Canadians suffers from chronic pain every day, and they still suffer from it. And so much of the work that I do with patients is trying to, as I mentioned, remove medications so they aren't feeling side effects and help them sleep a little better so they can cope with their pain. But the pain's still there. The research that's being done, especially here at the Faculty of Pharmacy, I'm really hopeful that that will help us mean that one day I could sit here and say in 10 years actually that we do have medications that can help actually reduce pain.
Our lab is interested in the neurobiology and neuropharmacology of chronic pain. If we think of pain as an alarm system that warns us of impending or potential harm, chronic pain can occur when this alarm system continues to occur long after the initial injury or event that would cause the acute pain in the first place. Most of the treatments that we have available for pain now, such as opioids and other commonly used drugs, simply depress the nervous system and subdue that pain signaling. The research that we're trying to do in our lab is actually treating what we consider to be root causes of that pain. So what changes occur in the nervous system to mediate and sustain chronic pain, and how can we reverse those changes to have lasting effects on chronic pain and hopefully alleviate the condition for people. Functionally, what we're trying to do is teach the nervous system to more or less forget that memory trace of pain, to reverse those underlying causes. So at a high level, what we've done is try to merge together two very promising fields of research, one from psychology and one from chronic pain, to hopefully develop new ways to tackle chronic pain.
I do believe that there's fundamentally a paradigm shift that has been changing in terms of how we view chronic pain. And I think that really comes with how we train our health professions, and we're seeing that, and I think the University of Toronto is taking a leadership role in training our emerging healthcare professionals to be more aware of what is chronic pain, who's more susceptible to experiencing chronic pain.
One of the main goals of the University of Toronto Centre for the Study of Pain is to merge together ideas to not only advance pain research, to develop new treatments for pain and advance pain management, but also to advance how we teach pain. The interfaculty pain curriculum was initially developed to address what was considered to be a major lack in pain-specific education among our health professional trainees. We've heard from many of the trainees who've gone through IPC that this interprofessional approach and this interdisciplinary approach to pain management has been extremely beneficial for their ability to work with pain patients. So it gives them a much better understanding of not only their role in managing an individual's pain, but how they work with other disciplines to come up with a holistic care package.
There's just so much we don't know. My dream would be that people don't have to suffer anymore. The hardest part of the job is seeing people who are suffering every day, trying to manage their pain, trying to be a good parent, trying to be a good student, and how pain interferes with all of that. I think there's a lot of amazing research that points to some progress in that area.
For me, the success in pain management is really, are we achieving the person with lived experience of chronic pain, are we achieving their goals? It's really tailored, it's really individualized, and it really comes down to what matters to the individual, and are we able to help them live their best life to its fullest potential based on their goals.